Have you ever wondered, does my dog really need heartworm prevention? Maybe your dog spends most of their time indoors. Maybe they don't go to dog parks. Maybe they don't hike, go camping, or really spend much time outside at all. And you might think, if my dog doesn't really go anywhere, how would they even get heartworms? This is actually a really common question that I hear from pet owners, and it's a really reasonable one. The answer comes down to understanding how heartworm disease is spread. Heartworms aren't passed from dog to dog through playing, sharing water bowls, or just being around other pets. They're spread through mosquito bites. And mosquitoes can reach even dogs that spend most of their lives indoors. Today, we're going to explain what heartworm disease is, how dogs become infected, why prevention is recommended even for indoor dogs, and what every pet owner should know about protecting their dog. I'm Dr. Matt Clark with Class and View Veterinary Clinic, and I'm here to help. This is Beyond the Vet Visit. Before we get started, I want to remind you that this video is intended for educational purposes only. Every pet is different, and the information discussed here should not be considered a diagnosis or a substitute for professional veterinary care. Heartworm risk, prevention recommendations, and treatment decisions can vary depending on your pet's individual health, lifestyle, and where you live. If your pet's experiencing coughing, difficulty breathing, weakness, collapse, significant changes in exercise, or any other concerning symptoms, please contact your veterinarian. The goal of this channel is to help you better understand veterinary medicine so you can have more informed conversations with your veterinarian and feel more confident caring for your pet. One of the things I think is important in veterinary medicine is explaining why we recommend the things we do. As veterinarians, we talk about prevention all the time: vaccines, parasite control, routine testing, and heartworm prevention is one of those recommendations that many pet owners have questions about. The important thing to understand is that heartworm disease is not spread the way that many people think. Dogs don't get heartworms from playing with other dogs, sharing water bowls, or just being around infected animals. Heartworm disease is spread by mosquitoes. And because mosquitoes can bite dogs almost anywhere, even dogs that spend most of their lives indoors can still get exposed. In this episode, we're going to break down what heartworm disease actually is, how dogs become infected, why indoor dogs still need protection, how heartworm prevention works, and what happens if a dog develops heartworm disease. We'll also talk briefly about cats, because while heartworm disease looks different in cats than it does in dogs, prevention is still an important part of keeping them healthy. By the end of this episode, my goal is that you understand not just that veterinarians recommend heartworm prevention, but why we recommend it. So, let's start with the basics. What exactly is heartworm disease? Heartworm disease is caused by a parasite called Dirofilaria immitis. It's a disease that affects dogs, cats, and ferrets, but dogs are the species we most commonly talk about because they're the natural host for the parasite. When a dog becomes infected, the immature forms of the parasite eventually develop into adult worms that live primarily in the blood vessels that supply the lungs. This is where the name heartworm can sometimes be a little confusing. Many people picture a worm simply living inside the heart itself. But the adult worms are actually most commonly found in the pulmonary arteries, which are the large blood vessels that carry blood from the heart to the lungs. Over time, these worms can cause inflammation and damage to the blood vessels and the lungs, which can eventually put stress on the heart. The severity of disease depends on several factors, including how many worms are present, how long the infection's been there, and how an individual dog's body responds to the infection. One of the challenges with heartworm disease is that it's often a slowly developing problem. A dog may appear completely normal on the outside while changes are occurring internally. That's one of the reasons prevention and early detection are such important parts of protecting our pets. So, if heartworms are living inside a dog's blood vessels and causing damage over time, the next question becomes, how does a dog actually get infected in the first place? Now that we understand what heartworm disease is, the next question is, how does a dog actually become infected? The answer comes down to one thing: mosquitoes. Heartworm disease is spread through the bite of an infected mosquito. Dogs don't get heartworms from simply being around another dog that has heartworms. The mosquito is the link that allows heartworm disease to spread. Here's how it works. First, a mosquito bites an animal that's already infected with heartworms. That animal has tiny immature heartworm larvae circling in the bloodstream. A helpful way to think about it is that these immature larvae are like little baby heartworms. They are very early in their development and are not yet the adult worms that cause the long-term damage we talked about earlier. When the mosquito takes a blood meal from that infected animal, it picks up these baby heartworms. Inside the mosquito, those baby heartworms continue to develop. A helpful way to picture this is that they're becoming more like toddler heartworms. They're still not adults, but they have developed into a stage where they can now infect another animal. Then, when that mosquito bites another dog, those toddler heartworms can enter that dog's body. Over the following months, those immature worms continue to develop and eventually become adult heartworms. This process can take about 6 months from the time of infection before the worms mature into adults. Once they become adults, these worms can live in the blood vessels associated with the lungs and cause damage we talked about earlier. So, when we talk about heartworm risk, the important thing to remember is this: the risk does not come from where your dog goes or how many dogs they interact with. The risk comes from whether an infected mosquito has the opportunity to bite them. And that's why even dogs that spend most of their lives indoors can still be exposed. Mosquitoes can travel beyond your immediate yard, so your dog's risk is not limited to what happens at home. Depending on the species and the environment, mosquitoes can travel anywhere from a few hundred feet to multiple miles in search of a blood meal. So even if your home does not have obvious mosquito problems, or your dog spends most of their time indoors, exposure can still happen. And that's why heartworm prevention is based on reducing risk rather than waiting until we know a mosquito has bitten your pet. Now we understand how a dog becomes infected with heartworms. But what actually happens inside the dog after that infection occurs? One of the important things to understand about heartworm disease is that it is a slow developing process. After those immature heartworms enter a dog's body, they continue to develop over several months before eventually becoming adult worms. Once they mature, adult heartworms live primarily in the pulmonary arteries, which are the blood vessels that carry blood from the heart to the lungs. The problem's not just that these worms are present. The bigger issue is the reaction they cause inside the body. The dog's immune system recognizes these parasites and responds to their presence, which leads to inflammation and damage within the blood vessels and surrounding lung tissue. Over time, this damage can make it harder for blood to move normally through the lungs. Because the heart is responsible for pumping blood through these vessels, it may have to work harder to overcome these changes. This is why heartworm disease is considered a serious condition. The damage can continue to develop gradually, and a dog may appear normal on the outside while changes are happening internally. That's one of the reasons veterinarians focus so much on prevention and early detection. The goal is to stop heartworm disease before it has the opportunity to cause lasting damage. One of the challenging things about heartworm disease is that many dogs do not show obvious signs early in the infection. Because heartworm disease develops slowly, a dog may appear completely normal while changes are happening inside the body. As heartworm disease progresses, the signs that we see are caused by the damage these worms create. The adult worms living in the blood vessels of the lungs cause ongoing inflammation and injury to those vessels and the surrounding lung tissue. Over time, this can lead to changes in the lungs, including scarring and reduced ability for the lungs to function normally. The heart's also affected because it has to work harder to pump blood through damaged and narrowed blood vessels in the lungs. In more advanced cases, this extra workload can contribute to heart enlargement and eventually heart failure. Early in the disease process, some dogs may have subtle changes, such as a mild cough, getting tired more easily during exercise, or less stamina than they're used to. These changes can be easy to miss, especially because many dogs naturally adjust their activity levels as they begin to feel different. As heartworm disease progresses and more damage occurs, signs become more noticeable. These might include a more persistent cough, difficulty exercising or tiring quickly, weight loss, difficulty breathing, weakness, and collapse in more severe cases. It's important to remember that these signs are not specific to heartworm disease. Many different health conditions can cause coughing, changes in energy, breathing problems, or exercise intolerance. That's why your veterinarian may recommend testing rather than trying to determine the cause based on only symptoms. The important takeaway is this: a dog does not have to look sick to have heartworm disease. That's one of the reasons prevention and routine testing are such important parts of protecting our pets. Now that we understand how heartworm disease develops, let's come back to the question that started the episode. Why does an indoor dog still need heartworm prevention? The simple answer is that the heartworm risk is not determined by how much time your dog spends outside. It's determined by whether an infected mosquito has the opportunity to bite your dog. Many owners picture heartworm risk as something that happens to dogs who spend a lot of time outdoors. Maybe a dog that hikes, camps, spends hours in the yard, or travels frequently. And those activities can certainly increase exposure to mosquitoes. But the reality is that even dogs with mostly indoor lifestyles can still encounter mosquitoes. Mosquitoes can enter homes through open doors, windows, or small openings. Dogs also have moments of outdoor exposure, even if they're just going outside for a bathroom break, short walk, time in the yard, or trips from home. The challenge is that we cannot predict when an infected mosquito is present. A dog does not need to spend hours outside, visit a dog park, or interact with other animals for that exposure. A single mosquito bite is all that is needed for transmission to occur. Another thing that surprises many owners is that living in the city does not necessarily mean that a dog has a lower risk of heartworm disease. Many people assume that heartworm is mainly a concern for dogs in rural areas, but that's not always the case. In areas with a higher concentration of pets, there may also be more opportunities for the mosquitoes to encounter an animal that's carrying heartworm infection. Remember, mosquitoes are the bridge that spreads heartworms. A mosquito bites an infected animal, picks up the immature heartworm larva, and then transmits it to another dog. So even in an urban environment where dogs may spend most of their time indoors and live in a neighborhood setting, heartworm exposure can still occur. This is another reason veterinarians focus on prevention rather than trying to predict which individual dogs will or will not be exposed. This is also why veterinarians recommend heartworm prevention for dogs with many different lifestyles. It's not because we assume every dog will become infected, it's because we know mosquito exposure can be unpredictable. Prevention is about reducing risk before infection happens rather than waiting until we know a dog's been exposed. And when we think about heartworm disease, this is especially important because the infection can develop silently for months before we ever see signs at home. So, while heartworm prevention is very effective, you might be wondering, why does my dog still need a heartworm test? Many veterinarians recommend routine heartworm testing, often performed yearly for dogs receiving prevention. But the timing of testing can depend on your pet's individual situation. Your veterinarian may recommend testing at different times, especially if your pet has been off prevention for a period of time, if doses have been missed, or if they're concerned about possible exposure. The reason is that prevention and testing serve two different purposes. Heartworm prevention is designed to stop immature worms from developing into adult worms. Testing helps us make sure that a dog is not infected with adult worms and that we're catching any problems as early as possible. Heartworm preventions are very effective, but no medicine works perfectly in every situation. There's several reasons veterinarians still recommend regular testing. Sometimes a pet may not receive a full dose of medicine. For example, a dog may spit out a chew without the owner realizing it, or a medication may not be given at the correct time. Another consideration is that pets can change over time. A dog may gain weight and no longer be in the correct weight range for the dose they're receiving, which is why it's important to keep your veterinarian updated on changes in your pet's size. There are also ongoing concerns about heartworm resistance in some mosquito and parasite populations, which is another reason veterinarians do not rely on prevention alone. The goal with testing is not because we expect prevention to fail. The goal is to have another layer of protection and identify infections as early as possible if they occur. The most common heartworm tests are blood tests that look for evidence of heartworm infection. One type of test looks for proteins produced by an adult female heartworm. This test is generally very accurate, but there is a note I want to make. This test technically tells you if you picked up heartworms 6 months ago because of the time it takes for adults to develop. So if your dog's not been on prevention any time in the last 6 months, your veterinarian might recommend repeat testing 6 months after getting back on prevention instead of waiting for your next test. If needed, your veterinarian can also perform additional testing to look for microfilaria, which are those baby heartworms in the bloodstream. Remember those baby heartworms we talked about earlier? Microfilaria are the early life stage of the parasite that is found in the blood after infection. These additional tests can help your veterinarian better understand what is happening and confirm diagnosis when needed. Your veterinarian will also decide which testing approach makes the most sense based on your situation. The important thing to understand is testing is not a replacement for prevention, and prevention is not a replacement for testing. They work together. Prevention helps reduce the risk of infection. Testing helps identify early infection before more serious damage can develop. And because heartworm disease can progress silently for months, regular testing is an important part of protecting your pet's long-term health. Now that we understand how dogs become infected with heartworms, the next question is, how does heartworm prevention actually protect my dog? Remember those baby and toddler heartworms we talked about earlier? Heartworm prevention works by stopping those immature stages before they have a chance to grow into adult worms. When an infected mosquito bites a dog, immature heartworm larvae can enter the body. The goal of prevention is to eliminate those immature heartworms before they continue developing and eventually become adult heartworms that cause the damage in the lungs, blood vessels, and heart. This is an important distinction because many owners assume heartworm prevention works by keeping mosquitoes away, but it's not how these medicines work. Heartworm prevention does not stop mosquitoes from biting your pet, create a protective barrier around your pet, or guarantee that a mosquito cannot transmit the infection. Instead, these medicines work by targeting the parasite at different stages of development before it becomes an adult infection. Remember our analogy: baby heartworms, toddler heartworms, adult heartworms. Most heartworm preventatives are designed to address those immature toddler stages before they can grow into adult worms. Some preventatives also have activity against the baby heartworms or microfilaria that might be circulating in the bloodstream of an infected pet. This is important because microfilaria can be picked up by mosquitoes and contribute to the spread of heartworm disease to other animals. This is why giving prevention consistently is so important. Heartworms take months to mature into adults, which gives us a window of time where we can stop the infection before it becomes a much more serious disease. There are several types of heartworm preventions available, including oral medicines, topical medicines, and injectable prevention. Most oral and topical preventatives are given on a regular schedule, often monthly, while some injectable preventatives can provide protection for longer periods of time, such as 6 or even 12 months, depending on the product. Another thing that is helpful for owners to understand is that many heartworm preventatives provide protection against more than just heartworms. Depending on the specific medication, some preventatives may also help protect against certain intestinal parasites, such as roundworms or hookworms. However, not every product protects against the same parasites. Each medicine has its own specific range of parasite coverage, which is why it's important to choose a prevention plan based on your pet's lifestyle and needs. Each option has advantages and considerations. Some owners prefer a monthly medicine that they give at home, while others may prefer an option that reduces the chance of missing a dose. Your veterinarian can help determine which option makes the most sense for your individual pet, lifestyle, and ability to give the medicine consistently. The most important thing is not necessarily which type of prevention you choose. The most important thing is having a prevention plan that works for you and your pet and is followed consistently. Because when it comes to heartworm disease, preventing adult worms from ever developing is much easier than treating the damage after infection has occurred. So far, we've talked a lot about preventing heartworm disease. But what happens if a dog actually becomes infected? The good news is that heartworm disease can be treated. However, treating heartworm disease is much more complicated than preventing it. The first step is recognizing the infection and confirming the diagnosis. The sooner heartworm disease is identified, the sooner your veterinarian can begin developing an appropriate treatment plan. This is important because adult heartworms do not just sit harmlessly inside the body. As we discussed earlier, these worms live in the blood vessels associated with the lungs and cause ongoing inflammation and damage. The longer adult worms remain inside the body, the more opportunity they have to contribute to lung, blood vessel, and heart disease. Treatment is designed to eliminate the adult worms. The medicine used to kill adult heartworms is called an adulticide. The goal of adulticide treatment is to remove the adult worms while minimizing complications and allowing the body time to recover. However, treating heartworm disease is not as simple as giving one medicine and immediately being finished. When adult worms die, the body still has to process and clear the remains. This is one reason treatment requires careful veterinary management. Some treatment approaches may focus on allowing worms to die more slowly over time, but these approaches can leave adult worms in the body longer. That means the worms may continue causing inflammation and damage while they remain present. For many dogs, the goal is to eliminate adult worms as safely and effectively as possible once infection is diagnosed. During treatment, dogs often need exercise restrictions because activity level increases the stress on the heart and lungs while the body is dealing with the effects of the infection and treatment. Depending on the severity of disease, some dogs may also need additional supportive care to manage inflammation and other complications. The exact treatment plan depends on the individual dog, how advanced the disease is, and their overall health. This is why prevention is such an important part of heartworm care. Preventing adult worms from ever developing is much easier on your pet than treating an established infection. The goal is not to just prevent worms. The goal is to prevent the damage those worms can cause. Although most of this episode has focused on dogs, it is important to talk about cats because they can also develop heartworm disease. Heartworm disease in cats is different from heartworm disease in dogs. Dogs are considered the natural host for heartworms, which means the parasite is better adapted to living and reproducing in dogs. Cats, on the other hand, are not the ideal host. Because cats are not the preferred host, the heartworms that do enter a cat's body don't always follow the same path that they do in dogs. Some immature heartworms may fail to develop normally or may migrate to places in the body where they cannot continue their life cycle. You can think of these worms as becoming lost in the body. However, that doesn't mean heartworm disease is harmless in cats. The worms that do successfully develop, along with the inflammation created by the body's immune response, can cause significant disease. Even a small number of worms can lead to serious problems involving the lungs and blood vessels. Signs of heartworm disease in cats can include coughing, difficulty breathing, changes in activity level, decreased appetite, and vomiting. Some cats may show very subtle signs, while others can develop sudden and severe illness. In some cases, heartworm disease can contribute to sudden collapse or even sudden death. Another challenge with cats is that diagnosing heartworms can be much more difficult than in dogs. There's not always a single test that gives us the complete answer, so veterinarians may use multiple pieces of information, including blood tests and imaging, to help determine what is happening. Treatment options are also more limited in cats compared to dogs. Because of these challenges, prevention is an especially important conversation for cat owners to have with their veterinarian. Every cat is different, and your veterinarian can help you determine whether heartworm prevention is appropriate based on your cat's lifestyle, environment, and individual risk. The goal is not just to treat disease after it happens. The goal is to prevent a parasite from causing damage in the first place. So, even though this episode is focused mostly on dogs, the same basic message applies to cats. Heartworm prevention is an important part of protecting your pet from a disease that can be difficult to diagnose and manage once infection occurs. Throughout this episode, we've talked about why heartworm prevention is recommended, even for dogs who seem low risk. Let's quickly address some of the most common misconceptions. Myth 1. My dog is indoors, lives in the city, or doesn't spend much time around other dogs, so they don't need heartworm prevention. This is probably one of the most common things veterinarians hear. Many owners think heartworm disease is based on a dog's lifestyle. My dog only goes outside to potty, my dog lives in an apartment, my dog doesn't go hiking or camping, my dog doesn't interact with other dogs. But heartworm risk is not determined by how adventurous your dog is. It is determined by whether an infected mosquito can reach them. Mosquitoes can enter homes, and dogs can be exposed even when limited exercise or outdoor activity occurs. Heartworms are also not spread through normal dog-to-dog contact. The mosquito is the link that spreads the infection. Remember, the important takeaway is this. Any dog living in an area where mosquitoes and heartworm disease are present may have some level of risk. Myth 2. My dog looks healthy, so they can't have heartworms. Heartworm disease can develop silently for months before outward signs can appear. A dog may continue to act normal while changes are happening inside the body. This is why testing and prevention are both important parts of heartworm care. Myth 3. If my dog gets heartworms, we can just treat it. Heartworm disease can be treated, but treatment is much more complicated than prevention. It's also much more expensive. It requires careful veterinary management, takes time, and is focused not only on eliminating the worms, but managing the effects those worms have on the body. Preventing an infection is much easier on your pet than treating an established disease. Myth 4. All heartworm preventatives are basically the same. Different preventatives protect against different parasites and have different schedules. Some are given monthly, while others may provide longer protection. Some products also protect against certain intestinal parasites. Your veterinarian can help choose a prevention plan that best fits your pet's individual needs and lifestyles. The biggest takeaway: heartworm prevention is not about assuming your pet will get sick. It's about protecting them from a disease that can be more difficult to detect, damaging to the body, and much more complicated to treat than it is to prevent. Heartworm disease is a condition that can be confusing because the risk is not always obvious. A dog does not have to spend hours outside, go hiking, or live a certain lifestyle to be exposed. The reason veterinarians recommend heartworm prevention is simple. Mosquito exposure is unpredictable, heartworm disease can develop silently, and preventing infection is much easier than treating an established disease. Heartworm prevention and testing work together to help protect your pet. Prevention helps stop immature heartworms before they can become adult worms and cause damage. Testing helps your veterinarian identify infection as early as possible if it occurs. Every pet is different, and your veterinarian can help you determine the best prevention plan for your individual dog or cat based on their lifestyle, location, and health. If you have questions about heartworm prevention, testing, or what is best for your pet, talk with your veterinarian. They know your pet's history and can help guide you towards the right plan. If your dog is showing signs such as difficulty breathing, collapse, severe weakness, or sudden changes in their ability to exercise, contact your veterinarian promptly. I hope this episode helped you better understand heartworm disease, why indoor dogs can still be at risk, and why veterinarians recommend prevention even when exposure may seem unlikely. If you found this video helpful, please consider liking the video and subscribing to the channel. And if there's a veterinary topic you'd like me to cover in a future episode, leave it in the comments below. I'm Dr. Matt Clark. Thank you for joining me for Beyond the Vet Visit, and I'll see you next time.